Hey everyone, welcome back to my channel. Today I'm going to be talking about sleep and what does a dentist have anything to do with sleep and why would I talk to you about that? Well, stay tuned to find out. Why would your dentist talk to you about sleep? Let's backtrack. What is sleep? I mean, sleep means we have to rest and we need a good airway to rest. So when we sleep, our airway actually closes down a little bit. So it gets a little narrower, all the muscles and tissues around the neck and the face kind of very much relax, and that can sometimes actually cause a little bit of a blockage. Now, what does that have to do with, what we see in the mouth? Well, the mouth is the beginning of the airway, and that's where I come in. I'm going to break this down into different components. So the first thing you need to know is that when we look in your mouth, we are looking at the shape of your mouth. So the shape has to be a nice wide U shape. If it's a V shape or narrow, then it's an automatic red flag for the fact that you probably have an airway problem. So my first question is, do you have any allergies? Have you suffered in your lifetime from, asthma or things like that? And often almost always I get, yes, I have. How'd you know that? And that's without looking at the medical history. Now, of course, I look at the medical history too. If I see that this patient is is on blood pressure medication, or maybe snores, things like that, of course those are very big red flags for the problem that then we're going to get into and discuss, because I really want to help you. I know that if your arch forms are normal and healthy, not only are you going to sleep and breathe better and live longer, and come see me longer, you are also going to have longer lasting teeth. And it's all connected. We sometimes forget that our teeth and our airway and the rest of our body, maybe our hip, the way we walk, has something to do with the way our jaw is positioned. So you have to think big, and a lot of my training has been done to really kind of think outside the box and be around, get educated in a way that helps me link different parts of what I see from your whole body to your mouth and vice versa. So one of the things that we look at, of course, like I said, is the arch form. And if the teeth are not only narrow, if the arch shape narrow, are the teeth tipped in, we'll probably see a lot of wear and tear on the teeth. Now, again, that means that there's not enough room for the tongue to sit in the top of the mouth. So when we swallow, if you close your lips together right now and you just take a swallow, think about where your tongue goes. Did it go to the roof of your mouth, or did it kind of go out through your teeth forward, or did it kind of sit at the bottom? So if it if it just went up and touched the roof of your mouth, high five what do you call that? Like raise the roof or touch the roof of your mouth, then that's great. That's a good swallow pattern, and that means you probably have a nice wide airway, or not airway, but wide arch form. But if your tongue went through, or your lips are apart, you have dry lips often, you're breathing through your mouth, then clearly there's something happening there. So when we see children from a young age come into the clinic, we are very concerned when we see them, again, with the dark circles or breathing through their mouth. And I know that as a clinician, I can really help guide the growth and development when you're young as a child, and I can talk to the parents. We can get you in to see an ear, nose, and throat specialist. We can help develop the arch forms a lot easier when you're young. So we do like to see kids, between the ages of 8 and 10, especially, to develop arch forms and make sure that they're going to grow into adults that have nice wide arch forms. If you're already an adult, though, it's a little bit different approach, and a lot of adults are not willing to, maybe they don't want to think about orthodontics, or they don't want to think about surgery of any kind to correct that. So we have other ways that we do address it, but at the end of the day, it really comes down to probing our patients more, like asking more questions, finding out what has been happening over their lifetime as far as their airway and their sleep, and then getting them to the right professionals. So There's only so much, or there is a lot, of course, though, that I can do as a dentist. I can develop your arch forms with something called Invisalign, which is a clear aligner therapy. We can upright teeth, we can expand arches, but also sometimes the blockage or the problem is at the back of the mouth, or it could be, adenoids, tonsils, it could be, excess tonsillar tissue. You could have a very kind of thick neck. There are modifying factors like weight and neck size, sex, gender, all that does play a role in whether or not you're going to get a good sleep. And a lot of times patients who are adults, particularly men, your risks are higher if you're male for some reason, but you will, you may get complaints that you snore, or you may feel tired throughout the day. So we're actually asking those questions too during your clinical exam, and not just looking at your teeth for cavities. So I feel as a whole mouth dentist, or somebody who really wants to look at for your whole health, I'm going to be looking at that. If we determine, if we make a referral to the sleep lab, there's a clinic here at the hospital. They're professionals. They actually will send you home with a sleep test, and that is just a little monitor that you put on your chest, and a little nasal cannula will actually measure the quality of sleep. It's a bit of a screening tool. It doesn't give us all the answers. Sometimes you actually have to go to the hospital to get like a full test done, where they really dive deep. But it gives us it's a really good baseline. So when I get that report back, I see the report, it coincides with other things that I saw in the mouth, then I may call you, or I may want you to recommend that you see your family doctor, because we really want to make sure that that's addressed. We cannot just solve all airway problems with just aligning arch forms, but again, it's a good start. So if you see your family doctor, or if you see someone to address the airway issue, maybe you have what's called obstructive sleep apnea, where there's actually a stop or pause in the breathing throughout the night. There's a score that comes with that, so we get a report. Maybe the airway's just narrow and you're just like you're breathing through a straw all night, or maybe it's a combination of that. So I really like to reach out to patients and help them develop or create ways to help solve this problem, because like I said before, if we don't address these things, you are going to be more at risk for health issues like heart attack and stroke, but you're also going to have a lot more damage, and we're going to see more problems with the teeth long term as well. So we really want to make sure that you are addressing it from all angles. So the ear, nose, and throat, again, I will sometimes also refer to the ear, nose, and throat specialists, and they will, of course, look at any other areas that are really causing a blockage, and sometimes tissues like adenoids and tonsils can be removed, or we can put you on some sort of nasal steroid and thing like that to help improve your nighttime breathing. Your risk as well, what's interesting about sleep, and when you don't get good sleep, or let's say you have obstructive sleep apnea, is a lot of these patients also suffer from gastroesophageal reflux disease, and that is also known as GERD, which is sort of like a heartburn-like problem. And what we see on the teeth is the acid will come up, and we'll see little potholes, or we'll see a lot of erosion on the teeth. So again, that's another sign that you're going to have a lot of tooth problems, but you also have an airway problem. So I love to talk about that, and I really love to help people address concerns that are just sometimes, I feel, probably a little bit outside dentistry. One of the big things that we do in children, and I touched on this earlier, is that we can talk to parents, and parents, of course, are always so helpful and willing to help learn and help their child, because a child who snores, or a child who is tired all the time, is not a normal child. A child should have energy. You should be the most energetic you are in your lifetime, really. And so if children are really hard to get out of bed, well, of course, minus not going to bed on time, then there's really something that should be looked into that. And orthodontics, as a general rule, is a really great approach to helping children, guide growth, so that we're not dealing with these issues later on when you're an adult. Because like I said, once you're an adult and these things and the forms of your arches have been created, it's a little bit harder for us to get complete resolution of the problem. So I love being able to help families and children especially to grow into adults that will get better sleep and have better sleep quality. One last thing about sleep, an interesting thing that I learned was that when you're not getting good sleep, so if if you're tired all the time, or you feel like you're falling asleep in the daytime, you have these periods where you just can't drag yourself out of bed, then you are also it not only means, of course, you probably didn't have a good deep sleep. Sleep is broken into many different cycles, and in the deepest form, if you're getting woke early in the early stages, you're not getting to the deep sleep. What that does is it affects our hormones release and regulation of our body's very different things in our body that regulate, for example, things like blood sugar. It could be mood, it could be brain function, all these things. But the interesting part about the sugars is that it actually will cause you to store sugar as fat, and you'll be more likely to have weight gain because you're not getting good sleep. So this is sometimes one of those points when I say to patients, it's really difficult to tell someone who has obstructive sleep apnea to just lose weight. I know that that's not that easy, because part of the reason why they are overweight is that they are not getting good sleep. So it's sort of a vicious cycle. So we can't just say, well, just lose some weight and then you'll sleep. Maybe you will sleep a little better, but how are you going to get the energy to really lose weight or to feel better enough to get exercising or eat better if you just don't have the energy? So I like to make sure people realize that not only are their health risks from a heart attack and stroke standpoint go up, but their risks of weight gain also go up when they don't get good sleep. So I hope you found that helpful. It's a really passionate area for me. I really think people should live and breathe and sleep well. So I really encourage anyone who'd like to leave me a message or throw me some questions. I appreciate it. If not, certainly like and subscribe for more content like this. And until then, I will see you next time.